today's episode of the vlog series. Today we're going to walk you through how to create the perfect medical CV. We've done a previous video on this, but we've updated the CV template. We've now got a section where you can download it from our website as well, so we're really excited to share it with you. We'll put the link to where you can download the template copy from, so you can work away on your own CV, but this video is going to walk you through each individual section of it and what you should include to give yourself the best chance of securing a job in the NHS as a doctor. All right, so the very first section, we're going to put it up on the screen so that you can see it. It's the professional summary. Of course, as a doctor, you need to have all the correct licenses, all the correct accreditations, and all the correct qualifications. So this is arguably the most important section of a medical CV. If you're an international doctor, which I know many of the viewers are, it's so important to get this the right way round. The most important thing you can do is exemplify to the NHS that you have all of the right credentials. So right at the very, very top, GMC registration and your registration number. Make sure that is front and center. If you've not quite got it yet, or you're pending ID check, write that down. Make it really clear where you're up to with the GMC status. Next down from that, we would go with any overseas registrations. So if you're registered with any medical councils overseas in India or even Ireland, wherever it might be in the world, put those down too. Follow it up with your postgraduate qualifications. So these are arguably the most important if you're a senior doctor. So if you come through the MRCP route or the FRCR route or whichever qualification it is, denote that just below, so that it's very clear that you are a senior level doctor. Of course, if you're a junior doctor and you've come through the PLAB route, denote PLAB down at this point as well. Equally, just below that, any internationally recognised qualifications as well. Things like DNB from India, because they are recognised training programmes. Whilst the GMC don't recognise them for registration, employers will often still recognise them as well, because it's such a common, well-trodden route that they do want to know about those qualifications, so do get them in there. Just below that, we would put your IELTS, your OET results, if you're coming internationally, of course. Again, it might seem obvious to you if you've got GMC registration that you've got IELTS or OET, but actually to an employer, they might not know the process as well as you do. You'd be surprised. So it's really important to just spell it out for them, make it really clear that you have everything you need in order to work in the NHS. Follow this up with your MBBS, your medical degree. Of course, highly important. If you're a junior doctor, you're going to be very proud of this. If you're a more senior doctor, you might find that it's been a little bit usurped by the Royal College qualifications that you've done later on in your career, but it's still very, very important to denote that. And then follow on with anything else that you think is of importance. Often things like life support courses or safeguarding courses that you've done, they can be really important to put in there as well, because they show that you've done the extra work and that you'll be a safe doctor when it comes to working in the NHS. All right, personal summary and career objective. Now, we often get asked the question whether you should include a cover letter with your CV. My personal advice is not to bother. I think that you can sum it up on the first page of your CV with 2 paragraphs. The first paragraph should be a little bit of history, background. It should encapsulate your career to date in a few sentences. And then the second should talk about your aspirations, your goals for your future career. So you might want to start by saying something like, I've worked as a medicine doctor for the last 15 years. I've specialised in gastroenterology and I've completed my MRCP with a view to joining the GMC register. The second paragraph might then be, my career goal is to join the NHS, complete my training and continue working as a consultant in the longer term. So it doesn't really matter what the content is, but keep it to those 2 paragraphs. Don't get too wordy with it. We see lots and lots of people going overboard and writing things that they love about themselves or their hobbies and all these wild things that actually aren't too important. I think if you're going to grab an employer's attention, it's got to be all about a brief synopsis of what you've done and then something just to say what it is you intend to do in the future that's going to get them all excited about your CV. Okay, so the next section is about competencies, procedures and clinical skills. This one is probably more important for an international doctor, an IMG doctor. If you come through a UK training pathway and you've got that on your CV, it's going to be pretty clear what competencies you've got because you'll have followed the same path as the person reviewing your CV. That said, if you're an international doctor, it's a really important section because what you're doing here is trying to tell your employer the differences between what you've done and what you do day to day in your home country, in your current practice, versus what is going to be done in the NHS. And that's particularly important, not because they're looking to trip you up or find out the things that you can't do, but it might just be to figure out the areas where you're going to need more support, more guidance, and more coaching. So we've always said split it into two sections. Talk about the things you can do independently and then talk about the things you can do assisted as well. If you can, and I know it's often difficult because logbooks don't always get kept perfectly well in other healthcare systems, but try and be as accurate as you can with numbers. If there's some things that you're doing day in, day out, then the frequency is going to be very, very high. If there's some things that you've done 3 or 4 times, note that as well. It tells a lot about what you've done and how you've done it. So this is a really important section and you really are looking to paint a picture to your NHS employer of the difference between what you're doing now and what you might be doing in the job itself. So the next section, of course, is your employment history. You're going to start with your most recent job and you're going to work your way backwards in chronological order. Really important to do that. You'd be surprised how many times we see CVs that are in the wrong order. They start from their medical degree and move forwards. You want to talk to them about the job that you are doing right now, most recently, at the very top. And the reason for that, of course, is that that's most likely going to be the job that's similar to the one that you're applying for. Again, there is probably a slight difference here. If you're applying as a doctor who's worked in the NHS, then maybe you won't need to include quite as much detail, particularly if you're applying locally. If you're moving from one trust in Manchester to a neighbouring trust in Manchester, then perhaps you don't need to denote quite as much detail about the type of hospital, the number of beds, the types of patients that you see and so on, because it'll be familiar to your employer in the NHS. That said, if you're coming as an IMG from a different country and you've worked in Alexandria in Egypt maybe, the person reviewing your CV is very unlikely to know the hospital. They won't know how big it is, the types of patients that are getting seen, how busy it is, all those types of things. So it's really important to make a note of those. Of course, you're going to talk about your duties and responsibilities within this as well. But before you do that, just make a note of the number of beds, the type of patients that you see, any on-calls that you work is really important because that's going to be a big thing in the NHS. So if you've done it, shout about it in this section. And basically, just as with the clinical skills and competency section, you're looking to paint a really good picture of the type of hospital you've worked in and the type of job you've done and how that will be similar or maybe different to the job that you're applying for in the NHS. Give most detail on the current employment, and then as you work backwards, less detail can be used. So if you're a junior doctor, of course, all of the detail might be about your internship and your post years from that. If you're a consultant, then of course you're going to want to talk about your consultant experience. Make it really, really clear if you do work independently. I think that's something that as a consultant you've got to spell out for the NHS as well. They want to know that you're working independently because that's exactly what's going to be expected of you here. And obviously the further back in your career you go, you might not need to talk in as much detail about your registrar and junior level work. All right, so there's a few additional sections that you're going to want to include at the end of your CV. Don't put these higher up in your CV as they're not seen as quite as important, and they're more going to be for points of interest, talking points during your interview. So they start with conferences and courses attended. Keep it relevant. I think the main thing here is that no one wants to know about every course you've attended for the last 20 years. Particularly if they weren't relevant to the specialism that you're applying to or the grade that you're applying to. So keep them to the most prestigious and the ones that you're most proud of. and the ones that are relevant to your employment that you're going to be applying for. The next one is research and publications. Now, depending on the role you're applying for, of course, this may be arguably more important. If it's a research-based role or it comes with an education element to it, then you might want to include this slightly more prevalently. Again, make sure they're all well cited and that they can all be followed up and checked if required. Very unlikely that they would be to look at them, but it is entirely possible. Awards and any accreditations that you've got is another section. So if you have won any prestigious awards, you might want to denote these here. If it was something particularly outstanding, you'd maybe even put it right at the very top on the front page with your other credentials. And then the final thing would just be any relevant skills or anything else that you wanted to share. So some people like to put any personal interests and hobbies in this section, but it might be any other professional skills that you've got, like leadership or anything like that too. All really important information, but can be put further back in your CV in the kind of order of preference. I think on the whole, the NHS are going to look at, are you qualified to do the job? Have you got the right licenses? They're then going to look at your skills and competencies. They're then going to look at your work history, and then they're going to get to this section. So you can leave it further towards the end, and it's probably only going to be 1 or 2 pages as opposed to the main bulk of it that are going to come earlier on. Final point, you're going to want to include some references too. Some people prefer to put references available upon request. Perhaps you've not quite told your employer that you're going to be leaving yet and you want to keep them confidential. That's usually absolutely fine. You will be expected to provide references covering the last 3 years and usually 3 references in number as well. So you can include them if you wanted to, and obviously if you've worked with someone who knows someone in the place you're applying to, then it's going to add a little bit of weight even if they don't make the application for those references. Usually references are applied for after someone has been offered a job, so it'll be a conditional offer based on good references. So you don't need to worry about including them on your CV and perhaps people getting contacted before you've even done an interview. So one final note is just around the formatting of your CV and a few little tips and tricks that we recommend as well. So the format of your CV, I mean, ideally download the template guide that we provided here. It's really good. It covers everything off perfectly. It's tried and tested. We've placed 1,500 plus doctors to date into the NHS, and most of the time we use this CV template. So it does work. It will grab attention. So feel free to download it. We'll put the link in the text below the video. But if you are going to use your own formatting, important to use things like tables, things like bullet points, keep it very clear, keep it very concise, particularly where there's listed elements like your credentials, your licenses and so on. Try not to play around too much with word arts and strange fonts and things like that. People want to see it in a professional font with clear headings, bold, and then of course normal text throughout. One thing we see quite a lot on international CVs is people putting things like pictures at the top, so photographs of themselves, which is acceptable in some cultures. It's not unacceptable in the NHS, it's just not something that's really done in the UK. You'll be judged on your professional skills and your credentials rather than what you look like. And equally, there's other things that aren't really necessary to include on your CV, things like marital status, religious beliefs. Again, in the UK, it is generally accepted that you can be whoever you are. You'll be judged on the basis of your professional experience and nothing more. So you don't need to include those elements on a CV for the NHS, but of course if you want to, you can. In terms of any other tips, if you wanted to get your CV reviewed by BDI Resourcing, then please do email it across to us, apply@bdiresourcing.com, and one of our expert team will be able to take a look. As I said, we've placed more than 1,500 doctors into the NHS, so we know a good CV from a bad CV, and we're more than happy to help. Thank you so much for listening to today's episode of the vlog series. as we've mentioned, please do download a copy of the template CV. It's completely free and we think it will really help you securing a job in the NHS. And if you wanted to have your CV reviewed, or if you want to talk about any upcoming jobs in the NHS, then please email us, apply@bdiresourcing.com. As always, we'll put the contact details up at the end of the video.